I was a registrar in neurology and general medicine, the two. I'd done it because I was interested in neurology and wanted to learn, and you made your own career in those days. You had to apply for jobs. If you were lucky, you got the one you wanted. And I got this job in which I learnt a lot of neurology. But my boss at the time was very much into private practice, and at that time there was a generation of doctors who had worked in before the NHS and regarded themselves as honorees. They called themselves honorees. My boss was one of those. And they seemed to think that they didn't actually have to come in and do their sessions. They let their registrars and housemen do the sessions. And I was stuck with a boss who, though he was a very good neurologist, and when he did turn up, he taught me a lot. But a lot of the time, he just left me to do his clinics. On one occasion, my wife was in labour with our first baby, and she had a difficult labour. And I rang him before the clinic and said, can I go home a bit early this clinic? The clinic would have finished about 5 o'clock. And he said, well, I'm not coming in myself, I'm afraid. I'm busy. And this was his usual thing. I was quite used to that. But on this occasion, I thought he'd make an exception in the circumstances. My wife had a very difficult labour. Eventually a forceps delivery in the early hours of the morning, and I had his whole clinic to do, which kept me until 6 o'clock worrying about her. And so I thought I'd get my own back on him, and I started the letters to the GPs and the consultants who had referred, because other consultants referred patients to him. I wrote, I saw your patient in the unexpected absence of Dr. X. And someone got back to him and told him this. And you didn't say that to consultants in those days. You had to treat them with the greatest respect, and I didn't. Anyway, I suspect it was Cyril Clarke, who was our professor of medicine. And Cyril, someone had told him, and he called me on one side, and he said to me, Seaton, the proper way of starting your letters is, I saw your patient on behalf of Dr. X. And I said to him, well, I'm sorry, if you're not going to come up to these clinics, if you're not going to come to your clinics, I'm going to say what I bloody well think. And I continued to write that until I got another job. But he said to me, he looked me in the eye and he said, don't ever ask me for a reference.